in a majority of patients, it is a silent disease. So there are no outward symptoms. Is that correct?
Yes. See, because prostate cancer is not a very aggressive disease. The neuroendocrine variant is aggressive, but it is much rare. I'm talking about the common one, the adenocarcinoma.
Okay.
It is not that aggressive, and it's very slow growing. So
Okay.
patients basically are not diagnosed with prostate cancer in the early stages. And sometimes, even though they get prostate cancer, they may not live long enough to diagnose that they
Okay.
have prostate cancer. And
Because
maybe,
of
yeah,
old age.
yeah, and maybe because, during later, by chance, if we've happened to find it on autopsy, then maybe we can see that there is a growth in the prostate.
Okay.
So it is not a very aggressive tumor to have.
But are there any symptoms that would present?
See, suppose if the tumor enlarges to a big enough extent, to a size that can cause symptoms like there can be urinary obstruction. This is
Okay.
like the most common symptom. That those are urinary. That is urinary obstruction. The patient may have to apply force during passing urine, or there can be a stop in the stream of
Okay.
urine during while passing urine. Okay, then there can be incomplete voiding, like the patient has to go to the bathroom once, and then maybe after some time he has to go and void again.
Okay.
So these are the few symptoms, and especially in older age men, these are a few symptoms that points towards having prostate cancer.